Hey guys, going to go ahead and talk about the pregnancy chapter PowerPoint at this stage. Hope everyone's doing well. Hope you're keeping up with your discussions and things. I will go ahead and share my screen now and we'll get right into it, okay? All right, so let's talk a little bit about exercise during pregnancy. Um, Pregnancy is controlled in a lot of ways by hormones, and that's a big factor in the stages of pregnancy. It does a lot of things for the embryo, it does a lot of things for the mother, and we're going to talk about some of those. So, one of the important hormones is listed here. It's estrogen, and what it does, it rebuilds the endometrial lining after menstruation. That is during normal life. It enlarges breasts during pregnancy and prepares them for lactation. Also helps to regulate progesterone levels during pregnancy. So what is progesterone? Progesterone, it maintains endometrial lining during pregnancy, and it limits the natural movements of the uterus to prevent contractions early. So progesterone is important in keeping the pregnancy viable, where you don't go into early contractions. Human chorionic gonadotropin. It's produced by day 12 after fertilization. It maintains the corpus luteum until placenta develops. And this is what's important about HCG, is what I'll call it here. This is what is detected by pregnancy tests. So whenever someone is doing a pregnancy test, it's this human chorionic gonadotropin that shows whether or not it's a positive or a negative. Relaxin, it's another important hormone. What it does, it's released early in pregnancy to limit uterine contractions as well. It softens the cervix in preparation for childbirth, and it makes joints in the body flexible. Now, the only issue with this is that there's some joints that become flexible. It makes them a little more prone to injury because of the extra flexibility that the mother is not used to. It also, though, some of the joints in the pelvic area become more flexible, and that allows for and prepares the body for childbirth. Prolactin. You'd think a lot. I go by a lot of things where you can look at prefixes and suffixes of words, and you see on this word prolactin, pro a lot of times kind of means adding or beginning. Lactin, you think of lactose, so it's just exactly that. Prolactin is produced by the anterior pituitary gland toward the end of pregnancy and following delivery. And what it does, it stimulates milk production in mammary glands. So pro-stimulate, lactin, milk production. It's a good way to remember that one. And you'll be tested on several of these. You need to know what prolactin, relaxin, each one of these are and what their purposes are. Oxytocin, it stimulates uterine contractions at the end of pregnancy, and it also stimulates milk ejection or letdown after birth, the release of the milk. So there's changes that happen in the mother's body. During the first trimester, they're listed here. You're going to see a lot of fluctuation in hormone levels. These fluctuations are a large culprit in morning sickness and promoting nausea. Breasts are going to swell and become tender. You'll see increases in perspiration. The fetus will start to enlarge and start putting some pressure on the bladder, so have to pee more. Fetal organ systems start to develop during this first trimester. And here, this is pretty important, and not so much the whole picture, but what you need to see from this is critical periods of organ system development. Not all organ systems develop at the same time, at the same pace. They don't take the same amount of time. Some things are developed in just a few days. Everything obviously is not listed on here, but you know, central nervous system starts early, as you see. We go through and you see how the organ systems are going to be different for each. Their critical period for each organ system will be different. So we'll talk about what critical periods are a little bit more detail here shortly, and we will you'll get a better picture of what's important about the fact that they have certain times when each one of these things are forming, okay? During the second trimester, the body starts to adjust to hormone levels, so the mothers generally start to feel better, which is a plus. Enlarging fetus is going to start promoting back pain, though. You have weight distribution and sometimes pressure against nerves that can cause this back pain. A change in the center of balance. So we're talking about exercise here. When center of balance is important because we need to think about what sort of exercises we're doing. We don't want to have things where the mother could fall, okay? Joints also are going to become less stable. That is another thing to watch out for with exercise, and we'll talk more about that as well. Sometimes reflux will develop in the mother as the uterus and fetus start to be displaced or move. Breasts will continue to swell, and sometimes you start to see edema or swelling. A lot of times you'll see that in the hands, feet, primarily seem to be a big place for that. My wife used the edema on the feet as a excuse for me to rub her feet every day. So, third trimester, you'll see the fetus enlarging even more. And they'll start crowding maternal organs. So the other organs have less room in their normal area because the fetus is obviously getting larger and larger and taking up some of that space. You'll see increases in the urge to urinate. A lot of times constipation will develop, you know, because of everything being crowded. That's part of what's going on. It's harder for the digestive system to send things around. You'll have fatigue during the third trimester, and Braxton Hicks contractions might develop. They're not true contractions, and that they're kind of practice contractions for the real show when it comes time to deliver. Respiratory changes during pregnancy. The mother is going to need more oxygen because she's going to be not only giving herself oxygen, but she needs to be providing oxygen to the growing fetus as well. So that's the main thing I want you to remember from this. This one's a little bit hard to read. So what are some precautions we need to look at during exercise? Increased core body temperature is something that we have to look at. This elevated core temperature, it can denature proteins, which basically means proteins aren't able to function normally in that state. Exercise, as we know, we all exercise and sweat. It produces significant amounts of heat. So extreme, prolonged, elevated temperature can result in neural tube defects in fetuses. Not to say that a woman who is pregnant has to stay inside in front of a fan in the air conditioner all the time. We're talking about extreme, prolonged, elevated temperature. So you don't want to go on a summertime mountain hike, you know, when you're just going to get super hot, super sweaty, can't cool off. Just common sense kind of thing that we have to think about as far as not doing exercises that could result in these neural tube defects. How do we reduce this risk? You can minimize it by maintaining hydration, avoid activity in hot and humid conditions, and make sure that you take appropriate rest/cooling breaks. Also, there can be interrupted blood flow to the fetus. That's something else to watch for. Blood from the mother is what supplies the fetus. Working muscles are going to demand increased blood flow. When you're working out, more blood has to go to the areas that are working. So some blood that is generally going to the fetus may be diverted away to the muscles during exercise. So if this was extreme and prolonged, then the fetus may be deprived of oxygen and nutrients, and we don't want that. In order to minimize this, we look to, it's one thing that helps. The mother has an increased blood volume and red cells, so red blood cells, so more oxygen is being provided anyway because of this increased blood volume overall and increase in red blood cells. The mother also has an elevated cardiac output and heart rate that accompanies pregnancy, so that helps to make sure that the fetus is getting the oxygen and nutrients that it needs as well. So decreased oxygen delivery to the fetus, as we said, we have to watch for that. Because the maternal cells need more oxygen with exercise, just said that, might deprive the fetal cells. If that happens, growth and development can suffer. Now that's probably would need to be on consecutive or kind of consistent basis in order to truly stunt growth and development. Again, the increased blood volume and the number of red blood cells that accompany pregnancy reduces and minimizes this risk. There's been shown that there's the possibility of an increased risk for low birth weight babies. Developing fetus is going to require extra energy from the mother. Energy may be used to support activity rather than to support the fetus. So low birth weight is usually due to lower fat stores in the baby. It doesn't really necessarily cause any health problems per se. And you see that in babies. You see some that are little bitty thin babies and some look like the Michelin Man. My kids look like the Michelin Man. I don't know where they got that from. Some musculoskeletal changes are some other things that we need to watch for during exercise. The body weight increases during pregnancy. Obviously, we know that. The center of balance changes. You have this weight in the front that's going to affect you. We've talked about how the joints become less stable because of relaxin. The risks from these changes, they can be minimized by avoiding contact sports. Probably don't want to sign up for football. Activities that require quick movements or high impact. So, cardio and things like that, not a big issue. But you just don't want to do things that are dangerous for the mother or for the growing baby. There are benefits of exercise, and we need to know these where we can motivate clients along the way. Exercise promotes a healthy weight gain. Your weight gain should be about 25 to 35 pounds, 3.5 pounds during the first trimester, and 1 pound per week thereafter. This is going to vary depending on the person also. So it just depends on what your weight is going into pregnancy, how much weight you need to gain. Birth weight is the greatest predictor of health for babies. Basically, if they're higher weight, they've had longer in the oven, more time to get ready and cook. Everything's formed as it should be. So the higher birth weight generally is going to indicate that they have gone full term or close to full term. Now, exercise can prevent unwanted weight gain by increasing energy expenditure in the mother. Another thing that's a benefit is that exercise preserves muscle and bone mass and minimizes fat mass. So you can gain weight and do it in a healthy way with exercise as part of the maternal plan. Circulation has been shown to improve weight gain during pregnancy, interferes with circulation and promotes edema or swelling. Exercise increases blood volume, cardiac output, excuse me, blood vessel number, and circulation is improved. Exercise also improves functioning of the lymphatic system, which can cut down on this edema. So in contrast to some situations where people exercise and they have swelling afterwards, you know, in the older population or somebody with an injury, something like that. In pregnancy, a lot of times exercise, the movement, the improvement that is shown in the lymphatic system and cardiac output, circulation, can cut down on residual swelling. Some other benefits: it reduces overall discomfort and improves mood. That is a common theme through the semester, that improvement in mood. Exercise alleviates the back pain, stiff joints, constipation. It helps with that because you're moving around. It's helping everything else to move around. Cuts down on bloating, and it helps with insomnia, which is also a common thing during pregnancy. Exercise maintains the joints' range of motion. Relaxin also plays into range of motion in the joints and helps to maintain that as well. Exercise is going to preserve muscle mass and strength. And very importantly, it improves mood, decreases incidence of depression in pregnancy. So you can see where this slide is very important and plays a big role in successful pregnancy. Being in shape and exercising can help to ease pregnancy, labor, and delivery. Your cardiorespiratory functioning is improved by increasing blood volume and red blood cell count, and also by improving the oxygen binding capacity of hemoglobin during and after activity. So it's grabbing on this, your hemoglobin gets some stickum on its hand, and it's able to grab that oxygen better because of exercise. Exercise also improves muscular functioning, preparing muscles for childbirth. Another thing, you see a risk decrease for preeclampsia. Preeclampsia is characterized, this is important, remember this, it's on the test. Preeclampsia is characterized by high blood pressure and protein in the urine. Those are the two things that are looked for, checked for by physicians. It is detrimental to both the mother and the fetus. If someone is already exercising and they become pregnant, if they don't have any contraindications, they've already been exercising prior, they should be able to continue that throughout their pregnancy. Should stay away from maximal exercise testing unless there's, unless it's absolutely necessary and there's physician supervision. Submax testing, where you could predict things like maximum oxygen uptake to design a better program, would be fine for most women. But that's the important part there, is that it would be submaximal. You wouldn't want to be taking them to the maximum level. As far as exercise prescription, previously sedentary women, women who have not been previously exercising and like, oh, I'm pregnant, I better start exercising. Those women, or some with contraindications, which I think we've talked about what those are, they need to seek medical clearance before starting exercise. And they also need to be screened using the Physical Activity Readiness Medical Examination. PARMED X for pregnancy is what that is called. So again, you want to begin all exercise with at least 5 to 10 minutes of low impact warm up, mild stretching following the warm up or during cool down. As far as cardiovascular training, you can perform that at least 3 days of the week, preferably all, it says here. Exercise for a duration of 15 to 30 minutes to accumulate at least 150 minutes of cardio training per week. You just want to be at a moderate intensity of 12 to 14 on the 6 to 20 Borg RPE scale. RPE, rating of perceived exertion, is what that RPE stands for, rating of perceived exertion. So if it goes from 6 to 20 and you're at a 12, you're middle ways. Again, avoid contact sports, high impact activities. As far as resistance training, you want to perform this on at least 2 days a week, 8 to 10 exercises targeting all of the major muscle groups. You want to work at an intensity that permits 12 to 15 reps per set. Something to watch out for is you don't want to do isometric exercises in the Valsalva maneuver, which is a situation where you're holding your breath while exercising. That could be dangerous. You're also withholding the oxygen that the mother and the fetus need if you're doing this Valsalva maneuver. Remember what the Valsalva maneuver is. Obviously, you want to avoid full sit-ups during pregnancy. You don't want to push anything out that's not ready to come out yet. And avoid the supine position after the 3rd month. You don't want to lay directly on your stomach. Some special considerations. You want to avoid strenuous exercise during hot, humid weather. Make sure that there's plenty of water. You don't want to exercise when severely fatigued. And that's where we've talked about before. You need to talk to your clients each time and make sure, how they're feeling that day and adjust what you're going to do according to that. You don't want to exercise at altitudes above 6,000 feet. You're going to have less oxygen available there. That could cause problems. Be aware that pregnancy increases energy needs only slightly, but exercise is going to ramp this up to a higher level as well. Free weights are something you probably should stay away from for the most part, unless they're very much trained in it already. It could be hazardous because of the joint instability that comes along with pregnancy. Stop exercising, seek medical attention if you start to see shortness of breath, vaginal bleeding, dizziness, headache, chest pain, amniotic fluid leakage, the water breaks. I don't think if you see that, you're not going to tell them to keep pushing forward. So decreased fetal movement, significant calf pain, swelling, or muscle weakness. Those are all things to stop immediately and seek medical attention. These here are just a sample exercise program, and like I say, it could be tweaked for depending on who you're working with. Warm up 5 to 10 minutes on a treadmill or exercise bike, mild stretching, some limbering arm movements. These are some example of the upper body exercises: chest press, seated row, shoulder press, curls. Lower body, seated pelvic tilt, thigh abduction and adduction, squat and Kegel exercises. As far as nutrition plays in, kilocalorie needs, energy needs during pregnancy increase by about 300 calories a day. That's really not a lot if you think about it. So people that are adding 3 or 4 milkshakes because they're craving them, you're going to gain more weight because of that, because the fetus only needs about 300 extra calories on top of what you generally would need. So anything else you're piling on top that's unhealthy, that's where the doctor will start telling you to watch what you're doing. Don't gain too much weight. To help with that, you can eat nutrient-dense foods to meet the needs without gaining a lot of excessive weight, which is harder to get off when it's all said and done. You want to have a minimum of 175 grams of carbs per day. You find that in whole grain breads and cereals, green vegetables, fruits, low-fat dairy. Protein, you want to have an additional 25 grams of protein a day, which would put you at a total of about 71 grams per day. Protein is a building block, so you see where that increase comes into play. You want to get that from lean cuts of meat, poultry, and fish, dairy products, beans, whole grains. Stay away from high protein supplements. As far as fat, you want to have about 13 grams of omega-6 fatty acids a day. Obtain about 1.4 grams of omega-3 fatty acids a day, but stay away from the fish oil supplements. They can sometimes have contaminants in them. There's some vitamins and minerals that are particularly important. Folate, vitamin B12, iron, calcium, and vitamin D. Folate, the importance of folate is that it prevents neural tube defects. You can find it in fortified grain, leafy greens, seeds, and liver. Vitamin B12 helps maintain nerve cells, and it's necessary for the body to be able to use folate, which we just talked about. You can find this in meat, fish, poultry, eggs, and cereal that is fortified. Iron attaches to oxygen and hemoglobin, and we know how important it is for oxygen to be able to go through the body. Pregnant women need to take 30 to 60 milligrams of supplemental iron a day for this reason. You can also find it in red meat, poultry, fish, eggs, dried fruit, and legumes or beans. Calcium, it's important because it helps with muscle contraction and nerve impulse propagation. We've talked about that. It also helps form bone structure. You want to have about 1,000 milligrams of this. Sometimes a supplement is advised, 600 milligrams. You can find this calcium in milk, tofu, broccoli, and legumes. Vitamin D, it's needed for calcium absorption in the digestive tract. So you see how these vitamins work together to cohesively to make everything work. You know, you need vitamin D for calcium. And they kind of plug in together to make each other work properly. You can find vitamin D in meat, eggs, fortified milk, butter, and cereals. The placenta is an intimate connection between the mother and the fetus. It develops by the 3rd month of pregnancy, and that's where nutrients, gases, and waste products are exchanged between the mother and the baby. It can be breached by hazardous substances. Even though maternal and fetal blood do not actually mix. Again, maternal and fetal blood do not actually mix during pregnancy, but exchanges happen at the placenta. I'm going to stop sharing for a moment because I have a meeting, and I'm going to try to come back and finish this later. Okay, guys, sorry for the interruption. It is a whole new day, so we're back again. Let me go back to the PowerPoint, and we will carry on from where we were. And you should be seeing my screen again now. We were talking about the placenta and how it connects the mother and the fetus. Again, one thing that I did bring up that is notable is that although that is where exchanges take place of nutrients, gases, waste products, etc., between the mother and the fetus, their blood does not actually mix. Although that is the case and their blood doesn't mix together, the placenta can be breached by hazardous substances. So what are some of these things that can cross the placenta and be harmful to the fetus? Um, we've all heard about alcohol being a no-no during um, pregnancy, as well as cigarette smoke. There's certain prescriptions and over-the-counter drugs that, one thing, it's almost comical when you watch television and you see these commercials come on and it gives the side effects and about 20 side effects in about 5 seconds. And then there's a little uh, disclaimer at the end that's probably in little bitty tiny writing so small you can barely see it, but you hear them say a lot of times, don't take this if you're pregnant or plan to be pregnant. I hear that on a lot of those. So a lot of medications, whether they're prescription or over the counter, can be harmful to fetuses. Listeria is something else that can cross the placenta, and caffeine in excess can be a factor, can be negative towards the fetus as well. And we have completed, and that, I wish I would have just finished up yesterday. At this point, I didn't realize that I only had the completion of that slide. I think I could have got in that other 2 minutes before I left. But anyway, as you've seen so far, if you're still hanging in there with me, these are, I'm taking the time to do these lectures and post for you guys as a supplement to what you have. If you really want to learn the material and you really want to get the tips and things that will help you when it comes time for testing, then it would be a good idea to, to read your chapters, do your discussions, and then watch these lectures, and you'll, take a few notes along the way, just like you were in class, and you will be in great shape for tests. You will do well on the test, and you will have made notes of the things that I bring up that are perhaps extra from what's on these slides. I know that I'm just rehashing what is on the slides, but I'm trying to give you some extra information that's not necessarily just on the PowerPoint. So I do hope that you guys use these and hope that they're helpful for you. So hope you're all doing well, and I will be in touch.